In today's world, life expectancy has increased significantly, thanks to progress in medicine and health awareness. Since the beginning of the 20th century, when the average lifespan was of just 47 years, life expectancy has grown at a steady pace, and most individuals around the world are now expected to live 3 decades longer. But birth rates, especially in the West, are not following the same trend. The combination of the two phenomena gives way to a number of social, economic and moral issues that must be confronted. The December 2010 Acton Institute conference entitled Ethics, Aging and the Coming Healthcare Challenge, held at the Pontifical Lateran University in Rome, was aimed at analysing and highlighting the importance of this demographic shift. The conference brought together religious authorities, academics, practitioners and policymakers from around the world. Bishop Jean Lafitte, Secretary of the Pontifical Council for the Family, which was amongst the event's sponsors, draws our attention to the magnitude of the low birth rates phenomenon and suggests that one of the possible reasons behind it is the notion of family values contemporary societies tend to adopt.
Among the causes, there is certainly a change introduced in the conception of family life and the conception on human life. And I refer, first of all, to the question of abortion. Abortion is not only a problem of moral and a spiritual problem. From this point of view, it's dramatical and it's a crime, no? You put an end to the human life. But from the demographical point of view, it's truly a catastrophe, because you have millions and millions of people being missing now in Europe and in all the countries in which abortion is legalized. In 35 years, 7 million of babies were not born because it was put an end voluntarily to their birth, to their life. No? If you now think that part of them today would be 35 years old, or 30, or 25, or 20, you can imagine that a part of them, a part of these 7 million, maybe 2 or 3 million, no, would have today a family and would have also 1 child or 2 children. So you can understand easily that the number of the persons who are missing in my country is about between 9 and 9.5 million people. It means more than 15% of the French population.
An immediate consequence of this demographic change is the necessity to rethink healthcare structures and services worldwide. The economic implications of tending to an increasingly old population is a theme policymakers will be urged to confront, as highlighted by Philip Booth, Editorial and Programme Director at the UK's Institute of Economic Affairs.
All Western countries are facing ageing populations. The United States is perhaps not as bad as most of continental Europe. One stark figure suggests that in 500 years' time there will only be, at current birth rates, 16 Italians left, ignoring immigration and ignoring improvements in longevity. So Western societies are ageing, and the number of young people who are working and paying taxes is likely to fall, in some countries quite dramatically, over the next couple of generations. In the context of health policy, when we talk about ageing societies, we can distinguish between 3 different processes. One is increased longevity in general, which leads to obviously people on average living longer, and it's easy to imagine that that would lead to a higher proportion of older people within the population. Secondly, we have a problem of reduced fertility, so fewer young people being born, and therefore as they go through the age ranges, fewer young people coming into the labour market and paying taxes in order to finance pensions and health care for the elderly. Thirdly, and this is perhaps the most interesting problem when it comes to healthcare, there is the issue of the relationship between length of life and length of healthy life, the healthy lifespan. So if people are actually growing older, but the proportion of their lifespan which they live in an unhealthy state is not increasing, then that need not be a burden in terms of the financing of healthcare, as long as the right policy choices are being taken. Throughout history, people have had children, and those children have cared for their parents in old age, both by providing personal care, but also through providing financial support when people become too old to work. And if the state provides all healthcare in old age and also provides all financial support in old age, then essentially there is less reason to have children. Instead of my own children within my own family looking after me and caring for me as I grow older, I could expect everybody else's children to look after me as I grow older, but through paying their taxes. Everybody expects everybody else's children to look after them, and there's a sense in which children become what economists would describe as a public good. And the incentives to actually have children and have larger families are undermined. And in addition to that, we have a welfare state which has many perverse effects in other ways, and in particular provides disincentives for people to form families when they have children, and also provides very strong disincentives to work. And again, this reduces labour market participation and just makes the financing problems of pensions and healthcare more difficult as the population ages.
A prime example of age-related health conditions is Alzheimer's disease, which affects millions of men and women across the globe, as illustrated by neurosurgeon Martin Bednar.
Alzheimer's disease was first described by Dr. Alzheimer approximately 100 years ago, just a little over 100 years ago in Germany. And what he saw under the microscope of the first patients with dementia were two abnormal proteins, the amyloid, the beta amyloid protein, and a special form of a protein called tau. And these accumulate in remarkable fashion in the brains of people with Alzheimer's disease. So from a pathologic standpoint, we see the sine qua non of Alzheimer's disease being this amyloid and tau accumulations in the brain in abnormal configurations in particular. What does that manifest to for an individual? So you have these abnormal buildups, these destroyed neurons that stop working, die, the brain atrophies at greater rates than normal aging, and ultimately, over a period of years and decades, this ultimately manifests itself as a decline in cognitive abilities and, finally, in social functioning. So individuals can no longer function in society as they used to previously. Right now, worldwide, approximately nearly 40 million people have Alzheimer's disease. Approximately 10% of those reside in the United States. So there's approximately 4 million people in the United States that have Alzheimer's disease. Those numbers will triple by 2050. So over the next 4 years or so, that number of 40 million will increase to approximately 120 million. When you look at the overall world population, this gets to be a very considerable amount. Clearly, this acceleration in the incidence of Alzheimer's disease from 40 million to approximately 120 million, or a tripling, far outstrips the growth rate of the world's population. So we are not only an aging population, but we are a population that is susceptible to many neurodegenerative diseases, and the one that is the most common probably is Alzheimer's disease.
Michael Hoden, Executive Director of the Global Coalition on Aging, draws our attention to forthcoming challenges and prospects socio-economic decisions that may be necessary to adapt to the current trends.
Alzheimer's is a good example. It's a very unfortunate one. There are many human and ethical concerns about it. But at its core, in terms of this massive shift that's taking place in society, Alzheimer's can become the 21st century fiscal nightmare. It can unhinge the 21st century. Today, in 2010, based on a study that was done over the last year we know that Alzheimer's costs roughly 1% of global GDP, roughly $604 billion. Now that's based on prevalence models that are assumed today. As we live longer, based on this longevity, we get to the place where when you live beyond 65, the chances of getting Alzheimer's and dementia become 1 in 3. When you live beyond 85, it becomes 1 in 2. So those numbers of 1% of global GDP and 604 billion explode to a place where, quite apart from the ethical, human, and healthcare issue, it's a fiscal nightmare. You add to that diabetes, cardiovascular disease, cancer, sarcopenia, which is loss of muscle mass that has impact on mobility, and you get to a place where age-related health diseases and conditions are such that they have to be addressed the way we found answers to polio. There was a day when HIV/AIDS was a death sentence, only 20 years ago. What about when infections would lead to death? Well, we can do this with age-related diseases now, but we need to apply the kind of research to it and the kind of approach so that we can find ways to mitigate that and ultimately cures. Because thinking about working into your 60s, 70s, and 80s doesn't make sense unless you have healthy aging. At the beginning of the 20th century, we roughly lived to age 47. We're now into our low 80s. I mean, this is a stunning, great advance. Now, there is an issue. The issue is not aging. The issue is this longevity represents a massive demographic transformation. It's further complicated by the fact that certainly in advanced, developed industrial societies over the last 5 decades, we have not been making babies. Probably better said, over the last 3 decades, the fertility rates have been lower. So longevity leads to a wonderful celebration that is this demographic transformation. The challenge is that the shift in the number of people over 60 or 65 and under 60 is very, very significant. And if we keep the more traditional model of work and retirement, the numbers just don't work. So that's where the change takes place. That's where the real challenge is, but it's a result of a tremendous development.
Alzheimer's disease is a genuine tragedy, affecting both the lives of the ill and society as a whole. But there is some reason for hope.
Alzheimer's disease is a very cruel disease from many perspectives, not the least of which is it is a very insidious disease for many people. For example, once you're diagnosed with Alzheimer's dementia, people live an average of 8 to 10 years after that, and they see their faculties being robbed from them. They see it at first. Ultimately, later on, they lose the insight to understand this, but all their loved ones still see it. So from any perspective, this becomes a very cruel disease, and people are very fretful of this. In fact, Alzheimer's disease is one of the most feared diseases in the world, right behind cancer. People are very concerned about losing their memories, about losing their independence, and about being dependent on people for even the most basic of functions, cleaning themselves, feeding, getting dressed. It's a devastating disease for many people. So we're very hungry right now for new therapies for Alzheimer's disease. At first, even what seems like a modest improvement in therapy for Alzheimer's disease can be monumental. Let me